Good evening, everyone. I'd like to call the meeting of the Deer Valley Unified School District Governing Board to order at 7 p.m. Our roll call will reflect that all board members except for Mrs. Reed are in attendance this evening. And if everybody could please stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. And now if you join me in a moment of silence. Thank you all. We could have a motion to adopt the agenda, please.
I move that we adopt the agenda.
And a second. Please. Thank you. All those in favor of adopting the agenda, please say aye.
Aye.
Aye. Aye.
Aye.
And please make sure to record your vote electronically through board docs. We'll move on to the next item of business, which is our return to school report by Dr. Zerbach.
Okay, good evening, President O'Brien, members of the board, Dr. Finch. As it always has been and continues to be, it is our pleasure this evening to provide to you and the community our return to school report. And I'm just pausing for a second to see if our PDF will come up, okay? So I may need some help moving to the slides, so if I could maybe just give a point. Okay, here we go. We are rocking and rolling. So our first two slides show some visuals from the past week. As you know, on Monday, we welcome back our high school students, 9 through 12, at our 5 high schools and Vista Peak. It was good to see the kids. Many of the cabinet members were on those campuses seeing the good work that all of them were doing. This third slide shows some pictures from 2 of our elementary schools. The picture on the left is from Copper Creek, and the picture on the right is from the traditional Academy at Bel Air, again, highlighting some of the great work that the students and staff are doing on our campuses. Okay, next will be the updates from our 3 return to school work teams. So let's start with return to school safely. The topic that is of most interest right now is the vaccination event that Deer Valley is coordinating along with the county and various pharmaceutical providers for all school-day staff in the DVUSD footprint. I've sent some of these details to you in the Friday update, and some of these you know as well from the communications that we have sent out to the Deer Valley staff members, but we will review these nonetheless here. So our dates for this very important event will start with the first doses on Friday, February 5th and Saturday, February the 6th. The times are listed there. There are asterisks that are posted on both of those days, as those times may slightly be adjusted depending on the appointment times that are selected from the school-based staff across our geographic footprint. We will do these vaccination events at 2 of our high schools. For our most centrally located Berry Goldwater, that will take the majority of the school-day staff. And then we do want to provide an opportunity for staff in the northern borders of our district. And so we will provide that event at Boulder Creek on those 2 days. Again, as I've noted before, this will be available for all school-day staff. And when I say that, that means staff that are in our public school district, in the charter schools, in the private schools, and also our daycares throughout our geographic footprint. And folks must provide an ID and something that proves that they are an employee of the school when they come for the vaccine. The vaccine that we used is the Moderna vaccine. And we are in planning right now with various emergency support personnel that will be at the two sites with us as we provide this important event. Right now, we are looking for sponsors, and we'll be reaching out to additional folks in the coming days to see if we can get some sponsorships for the volunteers that will be working the events, as there will be many, many volunteers on both of those campuses for those events. And then we will also repeat this again for the second dose later in March. An important piece for those who are watching is the calendar change. We announced this to the community in our Monday parent update, but Friday, February the 5th was originally scheduled for a PLC early release day. However, due to the logistical planning that is needed for this event, we do need to make this a true half day on this Friday, February the 5th. And we will continue to send out more reminders to our parents to make sure that they're aware of that. And our schools are also supporting us with that in their own bulletins that they send home to the parents. With that, I'll ask Jenna to come on and talk a little bit more about the parameters for that workday on February the 5th. Jenna?
All right, so we're going to take the opportunity to speak to this here for all of our staff members that might be listening in this evening. We've had quite a few questions regarding this specific day. It is a half day for students. It is not a half day for our staff. It is a normal work day, but it is specifically organized by us with collaboration from Maricopa and the vendors to provide this to our employees along with other educators in our geographic area. So because of that, we have made it clear to all of our supervisors that if an employee has indeed scheduled a vaccine through this opportunity, that they would be released to go take care of that. And that they would be released from the meetings or whatever would be taking place in the afternoon. That does also mean that our classified employees do not need to clock out. They just need to work with their Kronos editors to make sure that all of their time is reconciled after this appointment. So again, it is a normal workday for all of our employees. And if they do schedule this vaccine at this location, then of course we will allow them the opportunity to take care of that.
Thank you, Jenna. Our next slide contains information regarding the communication that we have had to both our parent and staff stakeholders. We continue to send our Monday updates to our parent community. We also send a variety of other written updates to our parents. Sometimes those come during the week on days other than Monday, and sometimes on the weekend as well. Those communications help us with COVID reporting, as well as announcing other events that are forthcoming. With our staff, we do continue, just as we have before, to do our fireside chats. We had our most recent one 2 weeks ago on January the 14th, and we'll have another one in February. We also have been sending various memos, both from Jenna and myself, to the staff regarding the vaccine. And then we have also put up on the DVUSD portal page a link that goes to the most up-to-date information regarding vaccine information. And then, of course, Dr. Finch has his Monday letters to the staff, which give them important updates as to the various happenings in the district. As you know, President O'Brien and other governing board members, we have coordinated with county 3 consecutive weeks of testing. We have done thousands of tests, which have represented a great opportunity for our staff, our students, and other community members to get tested. We are working with Maricopa County, as the slide indicates, to provide additional opportunities. And earlier today, we believe that we have worked out the logistical planning for that. And so we believe at a minimum, we will be providing at least once a week throughout the month of February, a testing event at one of our sites. Okay, in addition, for social emotional learning, we have an important webinar this Thursday, January the 28th, for our parents at 6 p.m. This webinar is sponsored by Katie McPherson. Most of you are aware of Katie. She has presented various webinars and presentations to our parents over the past 3 years. She is both a local and national expert in the area of social media. And we know this is a topic that is of great interest to our parents and to our staff members, as we know how important a role this plays with our students. And so this particular webinar will provide various tips and other good information to parents as far as how to help manage this in an appropriate manner along with their child. So very important event again this Thursday, January the 28th. Folks can get the link to that on the Return to School website. And these are recorded as well, and we place these on our Return to School website so that parents who are not able to view it on this particular date and time can view it in the future. But again, Katie has been very well received. Her information is very provocative. And so I encourage folks in the community to join us on Thursday, or if not, to take a look at it sometime in the near future, as I know you will find it helpful for yourself and for your teen. I know I have one myself. There are others at this table as well that do. And so it has been very helpful. Okay, and with that, I'm going to pass it to Mr. Miglerino, who's going to walk us through the most recent information related to the transmission metrics. Mr. Miglerino.
Good evening, President O'Brien, members of the board, Dr. Finch. As we have shared with you on multiple reports, we are going to provide the Maricopa County school dashboard metrics for the most recent period, which was last Thursday, January 21st. I think it's important to note that these metrics cover a time period back to the end of December 27th through the 9th of January. And one of the things that we are seeing is a little bit of a plateauing of the data. And we're going to also cover two other metrics that we monitor closely that I don't know that we have put in previous reports. So the first graph you see here is the case count, the cases per 100,000, up just a slight tick to 923 over the previous week's report. You can see how steep the incline was in previous weeks. So hence the use of the word plateauing for that particular metric. The rate of positivity is the graph on the right on this particular slide. And that actually declined from 29% the previous week to down to just over 25.6% for the current reporting period. The next metric actually is the COVID-like illness. And just as a reminder, COVID-like illness itself, if I can get you to advance the slide. Thanks. Is a countywide metric. So that is not specific to our district. The previous two metrics are specific to our district, and we do look at those that are specific to our district down to the detail of zip code information, because that's the most granular information we get from the county. But back to the COVID-like illness, again, a countywide metric. It also went down from 14.5 the previous week down to 13.7. Not major declines in both COVID-like illness and the rate of positivity, but nonetheless better than it had been in previous weeks when it was increasing. The slide on the right is the R0 for Arizona. This is the rate of reproduction of the virus. It is now below 1.0, meaning that the virus is not spreading exponentially as it has been when it was above 1.0. This number gets updated. I looked at it right before the start of this meeting, actually down just a slight tick today to 0.95. When we clipped this out yesterday, it was 0.97, so did improve in one day. And this number does change over time, even for the day that we're reporting here. It will change as data gets updated. But going back to the end of December, R0 has now been under 1.0, at least the way they're reporting it this evening. And then the next slide we're going to share is the 7-day epi curve. This data will continue to get updated, but as Dr. Zurbach has mentioned in previous reports, this is one of the metrics that does give us some leading indicator as to where the dashboard data metrics are going. And it is one of the tools that we use to even make the recommendation to convert to short-term virtual learning for the weeks that when we return for the second semester of the school year. And you can see that although it might be a little bit misleading to say that or to extrapolate the decline that you see at the end of that graph on the right-hand side of that graph as to what will actually be reported for those periods. That data gets updated, but you can see a plateauing in that period between January 2nd through January 9th. And that's the same data that we're seeing with the data dashboard metrics, for that same period. So we do think that there is a downward trend of the metrics. This has been predicted, not because we were, maybe we were wishing it for it to be that way and hoping and praying, but also the county officials have also concurred that that is what they're seeing. So some media reports of late are also reporting that it is good news that it is plateauing and maybe even declining. It's unfortunately at some high levels, so we will wait to see what the effect of the vaccines and other mitigating strategies have on what the numbers will look like moving forward. So with that, I'll turn it back over to Dr. Z.
Thank you, Mr. Miglerino. And I do want to remind the members of the board, Dr. Finch as well, that again, the metrics that we have taken you through, specifically the 3 metrics of case count, percent positivity, and COVID-like illness, that again, that is just one of the indicators that the county and ADHS recommends that we use when we make the decisions about in-person learning or not in-person learning. There are a number of other factors which we have gone over, really since October in a variety of formats, both in terms of here, the governing board meeting, parent webinars, and written updates, in terms of explaining that there are these additional factors that we look at when we have talked with the county in the past, and then of course what they continue to guide us with as we go forward. Those specific indicators we did put in writing again to the parents yesterday as a reminder to them. And we also included the joint statement that was put out by Director Flanagan, who is the Director of Public Health for Maricopa County, and Dr. Sonnenschein, who is the Director of Disease Control. As both of those 2 personnel in Maricopa County did put out a very strong statement of support of in-person schooling. That statement was first put out to us in the school webinars in mid-December. And so that statement can be accessed by folks if they do go to the webinar slides from the county for that. Okay, and with that, I will ask Ms. Mott to give us an update on PPE. Ms. Mott.
Thank you, Dr. Zerbach. Members of the board, honored guests, I am pleased to say that in the past 2 weeks since we started back to school, we've been able to deliver more than 2,500 gallons of hand sanitizer to our classrooms. They already had hand sanitizer in stock. This was just a refresher to make sure that they had everything they needed as the students returned to campus after winter break. In addition, we distributed more than 18,000 masks, cloth face coverings to all of our campuses. We have masks in child size, adjustable size. We have masks such as the one that I'm wearing here. Most of the masks that we've received and that we have in stock, we've actually received through grants from the city of Phoenix or county of Maricopa County. And about every 2 months, we do a mass order from all of the schools so that they just put in the quantity of each mask that they want, and we ship it to the campus. If a campus happens to miss that mass request, all they have to do is email me directly. And for example, we had a campus email today, and they have 300 masks that will be arriving at their campus tomorrow. Our warehouse does a fantastic job getting the supplies to the school or the department immediately as needed. I'm also very pleased to announce that thanks to the help of Monica Allred, we were able to receive a donation of over 3,000 canisters of Lysol disinfecting wipes. We just received those at the end of last week. They were a donation from the Kids in Need Foundation, and we look forward to getting those distributed to the schools within the next 2 weeks as well.
Thank you, Ms. Mock. Okay, and for our next slide, that will take us to return to learning, which is chaired by Dr. Galligan. Dr. Galligan.
President O'Brien, members of the board, Dr. Finch, and guests. I just have 3 quick topics to discuss with you this evening. The first one is tomorrow evening we'll begin our push to continue to address lost learning and lost credit. Specifically, this work team will be for our 712 students, and we're calling it the Student Achievement, Student Success Intervention Work Team. The goal of this team will be to create a menu of options that our schools can use to support students who have struggled since really last March.
President O'Brien, give us 1 second. We are being told we're having technical difficulties. Can you hear Dr. Galligan, President O'Brien?
Yes, I can hear her.
Okay, she can.
You can hear me? Okay.
President O'Brien, I'm going to do one more check. I believe you said you can hear her. So Gail, could I ask you to jump on real quick and just say test, and then we'll move on if you can hear.
Test, test, test.
I can hear her.
Thank you. We will continue on.
All righty. So this work team comprised of counselors, teachers, administrators, and department staff will come together for three meetings, and our goal is to have a framework in place by the middle of February for our schools to use to support kids from now through really the beginning of the 22-23 school year. Once we have this team well in hand, we will begin a K-6 work team to also address lost learning and the concern that we know our parents have with our kids going into first grade who may not have had kindergarten and concerns about retention. So that will be coming forward probably in early March. The second thing I wanted to bring to you is really kind of a sub-team of this first work team, and it is summer programming. I know that Ms. O'Brien, you had asked to have some information about fee or no fee, and Ms. Mock is part of this team. So as we review our current offerings from previous years and determine if there are additional offerings we can bring forward to help our students and our families, she will be there to help us determine what is available for non-fee and what will be fee-based. And those will be some of the things that team works. They come together on February 5th. And then the last thing I just wanted to bring to your attention is we are going to be starting our K-12 online school naming committee, and that will be made up of parents, teachers, and students who are currently involved in DVOA and DVOLP, as well as some of the department folks that work closely with the 2 online programs right now. Their task will be to provide a name, colors, and mascot. We'll go through the full process that a new school typically does. Ms. Allred has given us the way that we go about doing that, and she too will be part of this committee. And our intention is to bring a recommendation, our K-12 online school, to you on March 23rd. That's all I have for you at this moment. Thank you.
Thank you very much, Dr. Galligan. Okay, and next up is our third work team. This work team is chaired by Mrs. Jenna Moffett, the Return to Work Safely. Jenna.
Thank you, Gary. President O'Brien, governing board members, these are the 4 things that I'm going to quickly go over this evening. We can jump to the next slide. Before I start, I just want to communicate to everybody how much we appreciate the preparation for coming back to in-person learning. It's no surprise to our governing board that our employees are amazing. And I just want to acknowledge our DVEA group and our BLT group and our DVESPA group, because I know that they worked very hard over the break to help us communicate what it would look like when we came back in January. They navigated conversations with those that were so excited to come back and those who were apprehensive in the return. So I thank them for their time and their efforts there, and also to all of our leaders. We did a beautiful job opening both for the elementary side, middle school side, and then our high schools yesterday. So thanks to all of our employees. I'm very proud to work here in Deer Valley. Next slide. Okay, certified staffing timelines. I shared this with you briefly last time, and it is something that I will continue to go over as the spring or as this semester goes by, because it is always of such interest to our employees. Something that is unique this year, not unique to the practice of Deer Valley, but it is something that we haven't practiced in quite some time, is going through multiple rounds of internal staffing before we open positions up to the outside. I would say probably the last 8 or 9 years, we have gone through one round of district-wide internal staffing, and then we opened up positions to the outside, and then any future posting for the spring followed its own pattern that's outlined in the certified manual. Because we are anticipating some reductions because of our enrollment reductions as well, we want to make sure that our staff has enough time and has at least 2 efforts internally to interview and put in for positions that do post around the district. And I want to be clear that we have enough positions for everyone that is owed a contract for next year as it looks right now. I don't want to scare anyone by saying that. It just means that there could be more movement than we are used to seeing. So that's why we will go through 2 rounds. So the first round will begin on February 15th, the second round on the 24th, and then we review all employees that haven't yet secured a position, and we find them a position, and then we open those spots up to the outside. And just as a reminder to everybody that we did implement this year, because of the COVID year, a unique staffing MOU. And in that MOU, we did say, because of all the movement that would occur this year due to COVID, we would put everybody back to their original positions that they started in at the 2021 year. So when we have our staffing meetings that begin tomorrow, we will make sure that we reconcile all of that and hit the ground running for staffing beginning soon. And then next slide, always reminders to make sure that we report if we have COVID symptoms, if we come in contact with people that have tested positive for COVID-19. And also, I'd like to throw in here too, now that our employees are going to vaccination sites and getting the vaccination, there is a difference between what a vaccine symptom is and a COVID symptom is. And so if any of our employees are experiencing symptoms and have recently gotten a vaccine, please do still contact Human Resources, and we will help you navigate the difference between the symptoms of the vaccine and a COVID symptom. That's all I have for this evening.
Thank you, Jenna. And so with that, I will just reiterate one of Jenna's slides about the thank you. Really and truly very appreciative of the work that everyone has done during the short-term virtual for all, those who were involved in the free space learning. We acknowledge those staff at our previous board meeting. But again, everyone truly has stepped up, risen to the challenge. Super proud of our building leaders, our principals, assistant principals, everyone just doing a fantastic job. So with that, I will pause. President O'Brien, and just a reminder to the board that I do need a 1-second pause between the questions and when we talk, because I can't hear you if you're asking something before I turn the volume on. Okay, so give me 1 second, and then President O'Brien, please go ahead.
Thank you very much, Dr. Zerbach, and Dr. Galligan, and Ms. Moffett and Mrs. Mock. Mrs. Paperman, would you like to start off with your questions this evening?
Sure. Thank you for the information and the presentation. Yes, I do have a question because I know I did ask similar question last week, Barry Goldwater High School. So far, we have over 2,500 individuals that have been tested. Do we have a process within the district where there's transparency, where we know like how many students, how many staff has been affected by COVID? Just to be transparent, provide that to our community, because we want to keep our schools safe. So in reality, we need to know the amount of individuals that have been affected.
Yes, thanks for sharing that, Ms. Paperman, on that. And again, similar to last time, we have our dashboard, which has the cases at our schools.
Okay, question number 2. So I'm going to take my questions one at a time. So yes, I did ask also about a survey because I truly believe the decision making should be on database. So I know you mentioned that a survey was given within the community. So I'm just wondering, we're using data to make decisions of opening or closing the schools. I believe DVA, they did send a survey to the staff. From 1,200 staff, I would say I think like 70% of the individuals had concerns of returning to school. So I just want to make sure that we're being transparent at this decision making, that we're looking at community survey, staff survey to give everyone a voice, that this is a decision that we're all going to be included. So we don't have community like parents against parents, teachers against teacher. We need to be fair in the decision making.
Yes, thank you again, Ms. Paperman. As we stated at our last board meeting, again, we do meet with our employee associations, BLT, DVESPA, and DVOA on a periodic basis, making sure the loops of communication are in place.
Okay, thank you for the information.
Thank you, Mrs. Paperman. Mrs. Fisher, do you have any questions for this report?
Sorry, had to unmute. Would you prefer just I give you all of them and then you take it from there, Dr. Z? Okay. And I do communicate with our community a lot, both those that agree with me and those that disagree with me. I do support our kids being in school, I'm just saying that. But I did have a parent who does not agree with me that had sent me a lot of questions that I couldn't answer. I'm going to ask one of the questions is what was the guidance from Maricopa County? So I'll let you take and see if there's something different than what you've already said and provide that. Secondly, they would like to know where they can find the statement of support from Dr. Sunshine and Ms. Flanagan. Not in our presentations, but actually can it be found on the Maricopa, on their site? And so they want to know where they can find that. So if there's possibly a link we could give. They want to know if there is a long, and I'd like to know this one too, why the DVOA, DVOLP, what's the length that's going to be? How long is that waiting list, and is there any potential for the parents who do not want their kids in school? And then the last question, I'm just going to kind of read because it's kind of confusing to me. But the dashboard shows cases of the DVUSD as being grossly manipulated, even at the school and district level. Like 3 teachers in 3 different classes at the same school having 1 student each with a COVID positive test. All 3 were reported by parents on the same day, not a Monday, and 1 case shows up on the dashboard for the week. All 3 teachers confirmed with the nurse they were reported and sent it to the district. The nurse, the teachers, the parents inquired, and they have been ignored. Well, I don't know about that part. I don't want to read any of the parts that are accusations. I want just the question parts. So how is this impacting the public, and what is the public being told as far as these benchmarks? Are there other benchmarks, and what is that data? There's concern that the only people who are responsible for holding Dr. Finch and the district accountable are abdicating their responsibility. And so they really just want the answer. If our school numbers are low and all the information reflects kids are safe in schools, then we need something to show it with data to back it up. So is there anything, those are the questions that were put to me, and I would like to know too. I don't want to, but I want to make sure that the data that we have to tell our parents, we have to share our parents, and we have to include our parents. These are their kids. So I just, whatever we can help to help them, I would appreciate it.
President O'Brien, Ms. Fisher, thank you for those questions. So, Ms. Fisher, just so I'm clear, do you want me to repeat some of what I stated at the start of the return to school report about the statement of support and the guidance?
If it will help to clarify, because they don't want it to come from ours. I did hear where you said that it was in our presentation. They want it from the county. The part of, I mean, it's a lot of pages that I have that I'm not going to read through them all, but part of it that was sent to me was even screenshots of, these snippets. They want to be able to actually research and see it. We need to build the trust, because right now that trust is broken. And the best way we can do that is to show them where to find that data outside of our control.
Thank you. Understood. So let me repeat again. First of all, in terms of the statement of support, again, it can be found in the webinar slides that the county provides to the schools through the school county webinars on the weekly basis. And so, for instance, if you go in, I remember the first time that I believe I saw that joint statement was on December the 17th. And so community members can go on to the county website for public health, and there is a school webinar button. And when you go to that button, it lists, Ms. Fisher, all of the weekly webinars. So it's lengthy. So you have to click on the list, and then it'll go back for months. And so I know what I recall is the first meeting was December 17th when that statement was put in the slides. So it can be found there. As far as the guidance, I think I have covered that. I really don't have too much more to say regarding that piece. On the positive test, as I have said before, because some of those questions have come up about the dashboard, that the dashboard, there are reasons why sometimes a case would be put on and why it wouldn't be put on, depending on when the isolation period expires. And so that is something that it just is difficult for some community members to understand that particular part of it. If there is a specific piece that you have, Ms. Fisher, from a parent, then please forward that on to us, and we can take a look at that. But I am confident in our dashboard. We do a very good job, both HR and ALS and our principals, going through that data and communicating with one another about that dashboard. And then as far as DVOA, DVOLP, I'm going to defer a little bit to some of my colleagues here on that one. Jenna, do you want to take that, or Gail, a tag team on DVOA as far as the wait list? I'll do the start of it in terms of that, and then you guys can take it from there. That really, we have some capacity limitations for DVOA and DVOP just based on staffing. And so there's a fixed number of staff members for that. And so I'll ask Jenna or Gail again to come on and add on any nuances if they can, but really there are some limitations due to staffing.
President O'Brien, Ms. Fisher, yes. Any student that is currently put on a wait list, it is due to the staffing that we have on that side of our organization. So as you know, trying to spread our staffing as the first semester went by, preparation for this next semester, we did adjust, and I believe I shared in an update what the current teacher to student ratios look like. It looks much better than it did. However, within our special education teacher, our special education population and our capacity for teachers in DVOA, and also asking some of our brick and mortar special education teachers to step in, we are currently waitlisting special education students, but student support services and HR right now are in review of what capacity looks like at the brick and mortar as well, to see if there are any teachers at brick and mortar that can provide some additional support for any special education students that are on the wait list.
Just one point of clarification, because I think it might assist this parent. When we were talking about the 3-case example that she sent me, is it possible, because you said something different than a positive being reported versus a time period. Is some of this, is the time period's different, 3 kids same day, but 1 kid takes a test? Is that possibly a difference that might be what's changing the numbers? Because maybe that'll help them to understand. I'm inquiring because I know nothing about the testing at all.
President O'Brien, Ms. Fisher, yes, again, there are a multitude of reasons that could explain why a particular case is on the dashboard and why another is not. One example, even just with this, is the difference between a positive case and a quarantine. Sometimes folks in the community get confused as far as when a quarantine is happening and when an isolation is happening. The dashboard captures isolations, which are due to a positive case. And so that is one example. And again, there are numerous examples that could explain why. And the active isolation periods, as I mentioned before, is a second example. So.
I hope that answered the questions. If not, I'm sure I will hear about it and I will bring those back next time.
Thank you, Mrs. Fisher. Mrs. Ordway?
I want to thank everybody again for all of the information. And again, the many meetings that you guys have with Maricopa County Health that pertains not only to the general population, but specifically to ours. And I think maybe we could make that a little bit louder, that this is Maricopa County Health's guidance specific to our populations. I do have a request, and I know that we've just done it tonight, but if we could make clear, again, to our employees that if they have been in contact, perhaps with someone who's positive and are awaiting their test results, that they don't need to come onto DVUSD campus or facilities, wherever it is. Just to reiterate that, because we've done such a great job in mitigating, spreading things, and it may not be a total turning point that we're at, but with the vaccines coming, I just would really like it if we could just say it again. But thank you guys for everything.
Thank you, Mrs. Ordway. And I too would like to express my gratitude for Cabinet and all of the members who are meeting on our committees to ensure that our students and staff are able to return to school in person or have the virtual option that they do have. My questions are for Mrs. Moffett. The timelines presented for hiring, given the extra round of internal placements, will that still, do you believe that will still afford us an appropriate amount of time to fill from outside? In other words, I want to ensure that we're not lagging so far behind our fellow districts that we miss out on quality candidates. And then my second question is, must an employee return to their 2021 contract year position, or do they have the choice of whether or not they return?
President O'Brien, on your first question, the timeline, does it give our staff enough time to secure a position? I would say yes, it will, because the timeline really does look very similar still to the timeline we used last year. If you recall, we had pre-staffing for Bel Air and Union Park. So it really lines up nicely and even with the year prior. It also, positions will begin to open up to the outside, which also causes some adjusting. And contracts are anticipated to go out on March 12th. And so with all of that, that will open, of course, up some positions as it does every year, and will give staff time to adjust into a position. So yes, to answer that first question, it should, yes. Second, the second question, does each employee or each certified employee have to go back to their original position? The answer to that is yes. Each staff member will go back to their original DAC and original location. It doesn't mean, though, that that will be the place that they stay, and not necessarily because they volunteer to move through interview and transfer, but because of the new staffing sheets. The new staffing sheet may say that at the beginning of this year, they had 4 sections of third grade, but next year they're anticipated to have 3 sections of third grade. So that means we'll have to use the processes in the certified manual for spring staffing to address those types of surplus.
Thank you so
Yes.
much, Ms.
I'm sorry, but I think your question was, could someone choose to maybe stay where they are right now? They like their new position, they want to stay there. No, we did talk that out thoroughly when we built the MOU and agreed that it needed to be handled uniformly and that each person would come back to their original location.
Okay, thank you very much. And I do have another question for well, I'll come back to that later. Thank you very much. We can move on to call to the public. I don't believe we have any, we have one comment, but it will be under consent agenda. So could I have a motion for consent agenda?
Yes, I'm sorry about that, Mrs. O'Brien. I will ask that we move that the governing board will, hold on one second, approve consent agenda items, yes, A through G.
Do I have a second?
I'll second.
Thank you. And then, Mrs. Ordway, do you want to read the admonishment prior to the public comment?
Ms. Ordway, you are muted. Ms. Ordway, you are muted.
That's good because I'm looking for it. I thought Mrs. O'Brien was going to.
I've got it. I didn't know if.
Okay,
I
thank
have
you.
it. Okay, the board invites public comment on the district's business in general and on any agenda item in specific. All speakers must observe the rules of decorum. Speakers must fill out a card listing name, address, and topic and hand it to the board secretary prior to the president calling the meeting to order. Speakers must make their comments in no more than 3 minutes. If necessary, to accommodate all speakers within the 30-minute overall limit, the board president may shorten each speaker's time. Constructive criticism is in order. Rudeness, vulgarity, disruptive conduct, or remarks disrespecting personal dignity are not in order and will not be allowed. Under the Arizona Open Meeting Law, the governing board cannot discuss or act on any items not listed on the agenda. Board members may respond to criticism made by a speaker, ask that staff review a matter, or ask that a matter be put on a future agenda. And I believe Dr. Finch will be reading the public comment we have on consent agenda item A.
Good evening, board. Here's the email from Brian Starkey out of Anthem. So about the approval of the consent agenda minutes from a prior meeting. So, and it goes like this. In the January 12th board minutes, there was a considerable discussion about the use of COVID metrics and guidance from Maricopa County that were used to make decisions about returning to school. It was unclear from the minutes, as well as prior meeting minutes, what specific guidance or reporting was provided by Maricopa County. Further, it was also not clear from the minutes who was ultimately responsible for the decision to return to school in light of alarming COVID spread and trends. do not seek debate on the issue, but I seek closure to the open question reflected in the minutes. On whose authority was the decision made? If it was a vote of the board, I request that the minutes clarify the answer to the debate captured in minutes and a roll call of the vote to also be included. What data or guidance was used to inform the decision? In the January 12th minutes, Dr. Zurak implies the conversations were had with the Maricopa County and public health experts in their agreement with district plans. I request that information provided by Maricopa County and the referenced public health experts be entered into the record, including copies of the data used and reference to those from the Maricopa County and their respective recommendations for the record. Further, I'd like clarification for the record of a statement made by Dr. Zurbach at 1:20:25, where he references the dashboard data and suggests that the number of COVID cases is low. I will concede this point, but it is because the dashboard is based on self-reporting. Additional reporting requested of students and staff. The failing of AZDHS to provide contact tracing and the fact that they do not collect or provide data about what students or family members in your district or specific schools is the reason you are seeing underreported rates on your dashboard. Please correct the minutes to reflect that the dashboard is not accurate reflective COVID cases. What Dr. Zurbach is referring is a metric of how many students, staff tell you that they have COVID. That is no basis to make a decision about in-person instruction. Please accept my public comment and request to amend the record to clarify the items I've included. Most importantly, attribution of guidance and data and provided by Maricopa County and public health officials, as well as attribution to the final decision of decision makers for the record. And I can actually help this person. It really has three parts to the question. Who's ultimately responsible? That was decided on a July 19th board resolution. You could go back and watch that meeting there. That would give you the answer to that, and that is the superintendent. And then what data or guidance were used to inform this decision? That was a return to school report, which we do every meeting since, well, really the last 8 months. We do a COVID report, a return to school. So that is all included in there. And then the comment really about the COVID cases being low or high, we report that in our school return to school report. So it's not unusual for a community to say, hey, can you make the minutes more specific? We want this, we want that. That's not unusual. That's why we record it, and that's why we post it. So if there are parts of it that you don't understand, you can always go back and watch the return to school report, for example. So that's not unusual that we get a request to update the minutes or make them look different or have their different angle. But that's why we record it and post it.
Thank you, Dr. Finch. All those in favor of approving consent agenda items 5A through 5G, please say aye. Aye.
Aye.
All those against, say nay.
No, but I did want to say aye because he did ask for roll call, so.
And thank you, Mrs. Fisher, for bringing that up. And because we vote on board docs, every vote is a roll call vote. I think specifically to his question, there was not a roll call vote at the January 12th meeting on returning to school in person. So, but thank you for clarifying for us. Any against? Seeing none, passes unanimously. Did Mrs. Paperman vote? Yes. Thank you. Just wanted to clarify.
President O'Brien, Ms. Taylor says she does not have the vote from Ms. Paperman.
Mrs. Paperman, could you unmute yourself and record your voice vote?
Yes, I'm trying to see the vote on my computer. I don't see it.
Okay, do you vote yes?
The statement that Dr. Finch gave, I agree 100% with the person. So I would say nay.
Okay, so So Mrs. Taylor will record your nay and your board docs. The motion passes 3-1. May I have a motion for action item 6A? Mrs. Ordway, you're on mute.
No, I'm not. I would move that the governing board approve to alter the regular governing board meeting date from March 9th backwards to March 2nd.
Do I have a second?
I'll second.
Thank you, Mrs. Fisher. Is there any discussion on this item?
I know there was some concern about moving it because it was so close to the prior meeting. Is there something coming up that's super important that we're just moving it? Or, and I'd just like to know the reason we're moving it. I understand part of the reason that I don't want that revealed, but I'm just saying is there a reason we're keeping it?
Yes, Mrs. Fisher. My recommendation was to keep it. I think because we're in COVID and pandemic times, it will be easier to cancel it as we get closer if we need to, as opposed to adding it back in. So for now, we moved it
Okay,
to
thank you.
ensure we have it.
Okay, thank you.
All right. Any other questions? Seeing none, all those in favor, please say aye.
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 Wonderful. Any nays? Hearing none, the motion passes 4-0.
I would then move to go to action item 6B, that the governing board accept the administration's recommendation to pre-approve the addenda as presented.
I'll second.
Thank you. Is there any discussion on this item? All right. Seeing no discussion, I will call for a board vote. All those in favor say aye.
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 Any opposed, please say nay. Hearing none, the motion passes 4-0. Moving to item 6C, the results-based funding payment.
Yes, I would move that the governing board accept the administration's recommendation to approve the results-based funding loyalty payment to be paid out to be paid out to the qualifying positions in February of 2021.
Second.
Excellent. Do we have a presentation for this item? No presentation. Are there any questions by governing board members? Mrs. Paperman, are you good? Okay, all those in favor say aye. Aye.
Aye.
Aye.
Any against, please say nay. Hearing none, the motion passes 4-0. We will move on to governing board reports, and we'll start with Mrs. Paperman.
Okay, I would like to thank you for the presentation. What my concern I have listening to the meeting today is that I'm reading all the emails. We do have a division in our community and in our schools. So I'm just looking to see that, making sure that we're going to be making decision on data driven by doing surveys and seeing what our community needs, what our staff needs. We need to fix this division. So one of the things, like I also was looking, was the mission and vision of our district. We need to also consider where we stand right now, that we're probably gonna have to revisit that so we can start uniting our community.
Thank you, Mrs. Paperman. Mrs. Ordway?
Just want to give a shout out to the recipients of their awards this evening, our teachers of the year, rookies of the year, our, not sure if this is right, but our swimming state champion from Boulder Creek. All of the students and staff, coaches that are helping our student athletes be able to continue to compete. Thanks for everybody again. Not that over time, we've been saying the same thing, but the Herculean efforts that continue to happen on a day-to-day basis from our preschool children to everybody in our system is just unbelievable. And the opportunity to have Katie have a webinar for our social emotional health is going to be golden. And I hope that we are able maybe to have that also attached to our school websites in addition to the back to school, because the easier it is to access and to be able to access it often, the better. She's amazing. Anyway, that will be it. Thank you.
Thank you, Mrs. Ordway. Mrs. Fisher? You're still muted. Oh, there you go.
I just had to find it. Okay, first off, I'd like to again thank Daniel McCarthy and the Patriot Party for allowing us to use their facility to attend the meeting from and include space for our constituents to attend as well. And I'd like to thank Ms. Sheila for sending the care packages to the board members for the month. I was able to make my nice little cup with her logo that she sent. It's the district's logo, but she sent it. So I want to thank her for that as well. We are back in session in the legislature. I have currently been asked to review 58 bills regarding education that are going forward and provide my recommendation whether a couple of groups are going to support or not, which these bills are. And I would really like to share with our public that they have the opportunity to provide input to our legislators regarding the bills. It's really easy if they can go. I will be posting some on my site, but get involved. You can do a request to speak. The very first time you do have to go downtown and submit, but beyond that, you can do it all virtual and send your input. And these bills include everything from our finances to what your children will be taught or payouts, for different things that we have to do. There are some bills that did not make it out of committee, which will be coming back around. I've spoke to those legislators and they will be making some adjustments and they'll be coming back into committee. So nothing is done yet with any of them completely. Third thing, I'm going to kind of go out of order than what I have because I just want it done a certain way. Policies that I brought forward, Ms. O'Brien, I just wanted to make sure, and Dr. Finch, part of the reason I haven't sent in anything to change our policies, I would like a review of those policies as a board, as a study session. I don't think we should change them at all. I think they are written very well. I think we have given ourselves the leeway we need to serve our public as is stated in the law. However, they're not being followed. And so if they need to be changed, that's a different discussion. I brought up bullying in the last meeting and discovered, boy, we just have some fun bullies. And I almost wonder sometimes if we don't realize that people are being bullies. Maybe we don't realize when we're being bullies. It's a possibility. It's a probability, actually. So I did have a few come and seek me out, but they're welcome to engage. I just delete anything that's mean-spirited or hateful and move on. I will never delete a person because that right in itself is a bullying act. This is a little bit bigger. The trust board. We did get a response in the Friday update regarding the trust board, and my son told me to quit swearing when I read it. So I just wanted to again reiterate, I would like the board to have a discussion or a study session regarding a trust board. It is not uncommon to have a trust board. You can review many trust boards online. If you want to look at counties, you can look at Maricopa or Pima County. If you want to look at cities and towns, you can look at Gilbert, Goodyear, Flagstaff, Chandler, Sierra Vista. They all have theirs online. If you want to look at school districts, you can look at Scottsdale, Glendale L, Phoenix Union, Tucson Unified, Sierra Vista, all online. Well, of course they are. Trust boards are bound by the same restrictions we are. It is also spelled out in statute with the state organizations, depending on type. So I would ask the board members look at Arizona Revised Statutes 15382 in preparation for a discussion. And it is not for when you are working towards being fully insured. For the public, I want to clarify that being fully insured means basically you pay your premium and you just pay for insurance. And if you never use it, you never use it, but you paid for it. Being self-insured is what we are. And it is basically, we have a trust, we build up money, and we maintain that money, we manage it, we pay for our, we're actually in a pool with many other districts. We're actually in one of the strongest and best, in my opinion. Trusts cannot be dissolved. A school district cannot dissolve their trust. If they do so, they have to reduce the tax debt. So the only way to actually reduce, to defund a trust would be to underfund it and let it slowly go away. And in our case, that would take a long time because we have three very large trusts. Trust boards are to ensure oversight, appropriate funding, as well as other approvals for contracts, which do come up regularly. For the board members, I would recommend that you go look at the GESD, the Glendale Elementary School District. Their trust board has their documentation all online. And you can see what the trust board meetings look like. Well, you can't watch the actual meeting. It's not live stream like ours, but you can read the agenda. You can look at their experiences, look at a few of them. It's, I think it's a very important thing for us to do considering the value of our trusts. And then my final one is the masks. We have gotten inquiries as to why we are remaining virtual. And I have answered every one. We are virtual because I cannot wear a mask. I have a medical condition, which I don't believe anybody is entitled to know my medical condition. But I did get a letter from my doctor stating that that a mask is not possible. I do have shields, not just one, but two shields. One that goes from above my forehead to below my chin and from my chin up to above my nose. Covers more than any mask would. But this has continued. It's been a continuous issue, and that's why we're being kept virtual. The ADA paperwork that was sent out, I do believe is problematic. I am going to make a doctor's appointment. I am going to take it, and we will fill it out to the best of our ability without providing my official diagnosis. I don't believe having your private medical information out in the world to be used as they wish is appropriate. But I'm also looking into a civil rights concern with the Department of Justice. Back April 27th of last year, the Department of Justice sent out a memorandum concerned that civil rights and civil liberties would be infringed upon by governments and by organizations. And so they are looking into, they've been looking at that forever, since the beginning of this. Our civil liberties and our rights do not go away just because somebody says they're going to go away. So I am going to look at that as well. And it's not necessarily just for me, but I think that we need to be mindful of our parents We need to be mindful of our students, of our teachers, of our staff, all the way across. If it's this difficult as a board member to take it, I've taken extensive steps to provide the maximum amount of safety for anyone around me. And if it's this hard for me, what happens when we have a student who, or a parent or something, and I've gotten the answer. I've had parents tell me that they've been threatened with arrest. I've had parents tell me that they've been denied the ability to get their children. I've had parents tell me they've been threatened, not necessarily by our district, but they've been threatened with CPS being called on them over a mask. It's insane. And so the best I can say to the public is that I am doing what I can, and I will continue to look at it. I have sent an inquiry to General Brnovich as well, our Attorney General, and so let's see what the response is, and let's see where we need to go with this moving forward. And that's it for me.
Thank you, Mrs. Fisher. I would like to thank the Deer Valley Education Foundation and Charlie Philpick and their sponsors, Discover, McCarthy, DKG, Grads, Chase, Feldham's, and Valley Schools for sponsoring our Teachers and Rookies of the Year tonight. It was wonderful to see some of the awardees, especially since it covered such a variety of grades and subject matters, and they are absolutely correct when they say teaching is a work of heart. I'd also like to thank Sheila and the district for the bag of goodies that were given to each of the board members. Appreciate that. Thank you both to Maricopa County and City of Phoenix, as well as the Kids in Need Foundation for the donations for the PPE. That is definitely helps with our mitigation strategies. I do appreciate that. I would like to give a shout out to the Arizona School Boards Association for their webinar on the Elementary and Secondary School Emergency Relief Fund 2 webinar. I'm excited to hear about the additional funding that will be made available to our to Arizona and school districts across the state. Arizona School Boards Association has a Wednesday webinars. February 3rd's webinar is the top 10 tips for successfully advocating. And along that vein, I appreciate Mrs. Fisher bringing up that the session is in full swing. There is a House Bill number 2315, and it will allow candidates for school governing boards who want to get their name on the ballots to collect their signatures electronically. It will be in committee tomorrow. So if you have not had the opportunity to sign on to request to speak and advocate for that, I would encourage it. I believe school board members or candidates for school boards are one of the only or few offices who have not been able to collect their signatures electronically. Additionally, was part of a presentation by Dr. Heather Carter from the Greater Phoenix Leadership. She presented to school board members to receive input on the education game plan that the Greater Phoenix Leadership is trying to put together for Arizona so that we could have a comprehensive plan for education in Arizona as opposed so we could be proactive rather than reactive. So thank you so much to her for that presentation. And the Arizona K-12 Center has opened up their application process for the Arizona New Teacher Support Program. I hope that Deer Valley looks into if that's applicable for us to have that and apply there. And then tomorrow there will be a meeting with school board members and Superintendent Kathy Hoffman to discuss those ESSER funds, the ESSER 2 funds, so the new funds that will be available. So there's a lot going on in education right now with the legislative session and all the COVID funding and our budget season coming up. Don't forget that our survey is out there for our community to respond to our budget survey. So please, if you have not filled that out, do so. We want to hear from you. And that will do it for me. Next on our agenda is Dr. Finch.
Again, thanks for January for your service, School Board Recognition Month. And as you got your treats, we again want to thank Ms. Sheila for gathering them all together. And they all had a Deer Valley theme. Obviously, you need to represent. So thanks again for Ms. Taylor putting that together. And if you noticed, hopefully you followed me on Twitter and saw that Ms. Ordway received her 10-year pin. She's actually served for 13 years. So I told her we'll get her a bigger pin when she gets to 20. So looking forward to that. I don't know what happens at 50, like, so maybe you get a car or something, but we'll give you a bigger pin at 20, put it that way. Yeah, maybe a pin, a car pin at 50. Two things I want to mention that we're working on. I mentioned it last time, I want to mention it again. We have about 50 students a year that help me in particular, on the Student Superintendent's Advisory Committee. What's this council that works together? And what's unique about this year is these kids are doing, putting videos, social emotional learning videos around our curriculum that we have in our district, and the students put them together. It's pretty exciting. And they're on my webpage, on the district webpage, on my section under the superintendent. Click on, watch those videos. Those are shared throughout the district. And what's neat about it's done by the kids, 100%, which is totally cool. In fact, we'll be presenting at the National Superintendent's Conference here in about a week. And that will be featured on there. One of the ideas that other schools can borrow from us. So we're looking forward to that. I have mentioned to my staff as well, I'm still working on it, so this is kind of a notice to them that when I met with the Coyotes today, the Arizona Coyotes hockey team, professional hockey team, and I'm working on a relationship with them to provide us a connection for items that we can use for student behavior programs, et cetera, and I know my staff is pretty excited about that, so we're working on that. I'd say it'd be a couple of weeks probably before that all comes together. I just want to thank again my cabinet and the principals and the teachers and staff members that have all pulled together to get us going in the right direction and have school rolling. We're excited about high school coming back here this week and athletics starting with masks. I was at 3 gyms this afternoon watching the different sports go on. Obviously, the outdoor ones were canceled because it's raining and cold, and Arizona kids don't go out if it's under 71. So so we are officially canceling like soccer when it's raining. So in Alaska, we played when it was snowing, 10 feet of snow, we still played. Actually, that's not true. But thanks again for your service as school board members. We appreciate it. Thanks.
I would like to take a point of privilege to say that I watched the videos that were done by the Superintendent Student Advisory Council, and they are excellent videos. It's wonderful to see that group of students working so hard on the social and emotional learning, especially during this pandemic. It's always a good topic, but certainly never a better subject matter than in the 2021 school year. So thank you for that. They are doing an excellent job. Our future meetings are posted. I think this might be a record for a meeting time in my term. Could I have a motion to adjourn?
I'll make a move to adjourn.
Second?
Second.
All those in favor say aye.
Aye.
Aye. I'm hearing no nays. The meeting is adjourned.